DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, Sure Trace Mineral Supplementation by Timed Injection.
Hi there, folks. Welcome to DocTalk. I'm Dr. Dan Thompson, and I'm tickled to death that you joined us today. We're going to have a great show. Our guest is Dr. Angela Daniels from Dalhart, Texas, and she's a veterinarian and owner of a veterinary, more than just a veterinary practice, as you're going to hear as we go along. But we're going to talk about lowering somatic cell counts in dairy herds. Thanks for joining us, and stay tuned.
We started using Multimin 3 or 4 years ago. Anytime that you're able to supply a product like this that can boost the immunity system, get a better response from your vaccines, it kind of fits into a total program. We just feel like that the Multimin is kind of a reassurance that we're getting the most and the best performance possible.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Hi there, folks. Welcome to DocTalk, and Dr. Daniels, thanks for joining us.
You're welcome. Thanks for having me here.
You bet. Folks, Dr. Angela Daniels is owner of Circle H Headquarters, which has 4 different types of businesses within this business entity: a veterinary practice, a diagnostic lab, a contract research company, and a DHIA testing facility. And Dr. Angela Daniels and I went to veterinary school together at Iowa State University. So
many years ago.
Many years ago. So it's Old Home Week for us.
Yes.
And I'm
homecoming.
I'm very, very thankful that you take the time to be on the show.
Well, thank you for having me here. What I would like to talk about today is lowering somatic cell counts.
You bet.
I primarily work with dairy farms in the Dalhart, Texas region, and the past 2 years we've been focusing on milk quality, and somatic cell counts certainly drive that. There are bonuses that are out there available and just waiting for the taking if we're able to have low somatic cell counts as well as other low parameters on dairies. And so we kind of see it as virtually free money out there for the taking.
You bet. So we have some non-farmer guests on the show. Let's back up a little bit here and let's talk about what somatic cell count means.
Right.
I mean, if I have a low or a high somatic cell count, what exactly is that?
Yeah, that's a really good question. Somatic cells are just fancy words for white blood cells.
Okay.
And all milk has white blood cells in it because the body has a small army in it that's circulating around called our immune system. Mm-hmm. And if we've got a small infection going on in the mammary system, we're going to have more of the soldiers in the udder. So those are more of the white blood cells. Okay. And the real issue with that is they will lower the quality of milk and shorten the shelf life of milk. So we really want to keep those at bay. It's also an indicator that the milk that we're drinking is healthy.
Mm-hmm. So white blood cells, we want to keep them low.
Keep them low.
And it improves the shelf life of the product, but also improves the quality of the milk.
Absolutely.
All right. Well, now that we're on the same page, we got about a minute here before we go to break. What are some of the things that you know, when you first start out looking at somatic cell counts, what are some of the ranges that we're talking about?
Well, the range that you need to stay under to have bonus situations generally is under 200,000 cells per milliliter of milk. In the United States, the legal level is much higher than that, but in the European Union, we're looking at levels of 400,000 or 200,000 and below to be competitive with European targets.
So when we look at being able to provide more quality, that 200,000 tends to be more of a goal.
Absolutely.
Great.
A very attainable goal.
Absolutely. Well, when we come back from break, let's talk about how we might get there.
Sounds great.
Thanks for watching DocTalk, and we'll be back in a minute.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300LA from Norbrook. Specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle, Noromycin 300LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300LA is the practical choice for your herd.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
In the springtime, cattlemen need to be thinking of preventing important diseases like pink eye. Pink eye prevention includes management factors like good fly control, pasture management, along with a good vaccination program. Eyesight from AgriLabs has broad efficacy coverage as its origin from 8 different field isolates of Moraxella bovis. It is safe, smooth, highly syringeable, safe with young calves and pregnant cows, and provides superior protection against pink eye.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
This segment is brought to you by Norbrook Laboratories, manufacturers of Noromycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Folks, welcome back to DocTalk. I'm Dr. Dan Thompson, and my guest today is Dr. Angela Daniels. And Dr. Daniels is an owner of a veterinary practice in Dalhart, Texas. They have a veterinary practice. They have a diagnostic laboratory. Her company also does contract research, and they do DHIA testing. And you're busy.
Yes, that's fair to say.
And so, but when you're out there in veterinary practice and we're talking about lowering that somatic cell count, we're talking about trying to keep it to make sure we get the free money, the bonuses in our milk, and provide a more nutritious product. What exactly are we talking about doing to lower that?
Well, we'll talk through a few steps today, but
Okay.
Number one step is controlling your contagious organisms. These are organisms that cause mastitis, and they're spread from cow to cow. So they're important to keep those at bay. And there are 3 of them that we're really concerned about with dairy cattle. You know, the first one being Staph aureus. The second one would be Strep agalactae, and the third one Mycoplasma bovis.
Okay.
Now, Strep agalactae is primarily handled at the dry-off time. Most dairy farms use dry cow therapy that really keeps that particular organism at bay. So it's not one that we talk about on a daily basis with the farms that I work with.
So when we're talking, and again, I'm going to go back to our dry off, meaning that this is the point in time where the cow is going to not be producing milk.
Correct.
And we're going to go back into a point in time where she's not milked until she has that calf.
Yeah, primarily 60 days before she has a calf, she gets to go on a short little vacation and rest up and allow her udder to regenerate so she can be a lactating, productive cow after she has that calf.
Yep.
So that's a really great time to address some of these issues,
You
for
bet.
sure, like strep agalactae.
Yep.
The other 2, however, are more problematic. Staphylococcus aureus likes to set up abscesses in the udder, and it's virtually impossible for older cows to be rid of this organism. So I like to talk with producers that might have some Staph aureus in their herd, as well as Mycoplasma bovis in their herd, to consider segregating those cows, or perhaps even having a culling program. If you've got extra heifers coming into your herd, it's a really good thing to take advantage of that situation and remove some cows that are problematic. And I want to remind everybody, these are contagious organisms. They'll be spread cow to cow via the milker's hands, via
Right.
flies, contaminated environment like bedding. So it's really important that we find out who these cows are and have a game plan to address that, because certainly these organisms will drive up your somatic cell counts and
Absolutely.
spread through the herd.
And so having good biosecurity is very important when you're talking about
is.
something that's spread cow to cow, whether it's clean bedding, you know, cleaning the equipment and different things like that.
It is, and if you're in a situation where you're purchasing animals, it's important to keep biosecurity in mind. It would be a great idea to maybe pre-screen some of these animals if they're lactating, get some milk cultures, get a history of the farm of what contagious organisms that they've had, perhaps take a look at their bulk tanks and just see exactly what is circulating in the herd.
It's great information. When we come back, we'll talk more with Dr. Daniels about lowering the somatic cell count on your farm.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
ValleyVet.com, ValleyVet.com, Valley Vet Supply.
Join the team, the Beef Quality Assurance Team. Getting BQA certified shows you're committed to practices that produce the highest quality beef in the world. And by visiting BQA.org, you can take the online certification course at a time that fits your schedule and from the comfort of your home or office. You'll also find lots of helpful tips on improving animal health and animal handling practices. Get certified, BQA certified, because it's about doing the right thing. Visit BQA.org today and become a member of the BQA team.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noromectin line from Norbrook is the practical choice for your herd.
This hog is Hanover hoof for meal made from U.S. soybeans. Now, one hog isn't that impressive, but suppose we add another, and another, and another. Before long, you've got billions of hungry customers around the world all clamoring for the same thing. Our soybeans. Learn more about the billion-dollar appetite of animal agriculture at BeyondTheElevator.com. Brought to you by America's soybean farmers and their checkoff.
Been here for 42 years now. We run around 2,500 cows. I bought a couple loads of cattle out of cows, black cows out of California. And most of these cows are kind of a off-color, rusty color. We're going to be processing these cows in the next few days, and at that time I will inject Multimin into them to help take care of their copper deficiency. I would recommend Multimin to any cow man, and it's been effective.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
True Test Group, weighing systems, electronic identification, EID, electric fencing, and dairy automation systems help farmers and ranchers around the world manage the performance of their livestock for ultimate profitability.
Hi there, folks. Welcome back to DocTalk. I'm Dr. Dan Thompson from Kansas State University, and my guest is Dr. Angela Daniels, who is a veterinarian and owner of Circle H headquarters in Dalhart, Texas. And you supply many different types of opportunities for dairy producers and clients and swine and different things in food animal. And I know that you're extremely busy, so to have you on the show is just wonderful.
Well, I'm glad to be here again. Thank
That's
you.
great. And we're going to talk now about lowering the somatic cell count and continue the discussion. And as we spoke during the break, we're going to talk about how you monitor that individual cow.
Correct.
All right.
Correct.
So I'll let you take it.
You bet. We talked earlier about keeping the contagious organisms at bay. The next thing that we want to talk about is looking at actual somatic cell counts. Our company does DHIA testing, so Dairy Herd Improvement Association testing. Not all of the farms that we work with are a member of DHIA, and that doesn't preclude you from being involved in this type of testing. So once a month, we recommend that you have a tester group come in and measure how much milk your cows are producing and collect milk samples. And we take a look at those and we look for somatic cell counts. And it's important to remember that all of this milk is pooled together. And so high producing cows that have high somatic cell counts really sway that bulk tank somatic cell count. And so those are cows that we want to identify and have a game plan to work with.
So when you're, and it makes some sense that you're trying to identify those high somatic cell count animals that can probably really skew your data for the entire herd off to the right.
Correct. Yeah, so after we do a test, we like to make perhaps a hot list to look at cows that might be repeat violators 2 months in a row that would have high counts, or maybe she had an off month where she was coming down with a case of mastitis. Take a look at those cows, find out, did she visit the hospital? Did she have a mastitis event? Or maybe we need to pull her aside, take a look at her milk, and make a decision. Is she a cow that we should put into the hospital and do some treating to try to get her infection, which might not be a clinical infection, could be a subclinical infection, cleared up, so that we can lower the overall amount of somatic cells in that bulk tank to get you closer to that bonus.
And I think that you know, when we're starting, and I'm sure it's similar with mastitis in dairy cows as it is with respiratory disease in calves, but you have animals that are new cases, animals that are old cases, animals that are chronic cases, and probably getting those chronic cases identified and removed is
absolutely.
Important. That's what we deal with a lot on respiratory disease.
Same concept. We like to look at 4 categories. New cases, cases that have resolved. Then we like to look at chronic cases, and then cows that are perfect and haven't had any cases. And obviously, we'd like to see the most amount of cows in that quadrant.
Yeah, that's the goal.
Yes.
To get in those. Well, it's a great time for us to take a break.
Okay.
Great information, learning a lot, refreshing some of my dairy information, but you know, it's important. A lot of people, it's an important product for everybody in our country, and producing wholesome, safe milk is important.
Sounds good.
Thanks for being here, and thanks for watching Doc Talk. After the break, we'll wrap up with Dr. Angela Daniels.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
This is Agriculture Today from Kansas State University. In the quest to find out more information about the role of what are called beta-agonist products in cattle feedlot operations and finishing rations, K-State veterinarian Dan Thompson, who's been in on quite a bit of the dialogue over beta-agonists.
We've seen this in other species. The swine industry 15, 20 years ago discovered this fatigue pig syndrome, and that's kind of what we've called it now. Fatigue cattle syndrome is what we're calling the syndrome that we see as far as these cattle at the plant that are slow moving. We have to understand that when we have seen the issues with cattle with this fatigue cattle syndrome at packing facilities, it's during the summer months where we have heat stress.
This is K-State Research and Extension.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
This segment is brought to you by the Beef Quality Assurance Program and the Kansas Beef Council, improving animal care and beef safety for more than 20 years.
Folks, welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Angela Daniels. And Dr. Daniels is owner of Circle H Headquarters, which is located in Dalhart, Texas, that provides veterinary services, contract research services. They have a veterinary diagnostic lab and DHIA testing. all for dairies and all around the area in the United States, and we're tickled to death to have you here and spend some time with us. Now, where are we going to go?
Well, let's put it all together. We talked about controlling contagious organisms.
Yep.
We talked about looking at individual somatic cell counts and addressing the high volume cows with high somatic cells.
Yep.
The last thing we want to talk about is answering the question of, why are all of these things in my herd? And when I think about lowering somatic cells and having good milk quality, it's really a lot of little things being put together, and it's paying attention to the little stuff. So the last question we really need to focus on and answer is, what does the environment look like? When she goes and lies down, what is that environment like? Is it clean? Is it something that's going to promote good udder health? What about the milking procedures? How often do I go in and refresh my milkers and do some retraining? And we don't have time today to talk about what your procedure is, but is it consistent? Do you dip and strip and wipe and apply, or do you strip and dip? None of that matters at this point, but is it consistent, and are they clean? What do your towels look like that you're wiping off the teats with? Are they clean? Do they smell fresh? Would you wipe your face with them? If the answer to that is no, then you probably don't want to be wiping off the teats of your cows with them.
Right.
So it's really putting it all together. It's all of those small things that make a huge difference at the end of the day.
Yeah, and I start to think about, Gary Gentry, who managed Lubbock Feed Yard, used to say the three most inconsistent things in the world are cattle, weather, and people. And
we have all three.
Yeah, and when we're dealing with something like this, they're all three such big factors. It sounds like on the somatic cell count that making sure that people are properly trained, and I'm sure that you work with people on farms to train the trainer or train the employees when you're out.
Right. It's a constant progression of continuing and reminding people of the things that we want them to do. But I like to think of a dairy as being a large orchestra, and there's a lot of things going on at the same time, and everybody's role is extremely important. So when those cows are in the parlor, we should have somebody grooming the stalls or taking care of their bedding, adding bedding. Then the feeder needs to come by and feed them, and that's really important because when they go back, they're going to be hungry and thirsty, and their teat orifices are still open. So we want them to go and spend some time at the feed bunk while that udder begins to refill with milk. Those teats hopefully were dipped very, very well, and that's another small thing, but we're going to give her a good half hour for those teat orifices to close so that organisms can't get back up into that udder. So it's a big orchestra of a lot of different things going on, and one little thing that gets thrown off makes a really big difference.
Well, thanks a million for joining us today on the show.
You're welcome.
It was great information. Folks, I hope you enjoyed it as much as I did. If you want to know more about DocTalk, you can find us on the web at www.doctalktv.com. Remember, always work with your local veterinarian. I'm Dr. Dan Thompson from Kansas State University. You've been watching DocTalk. We're sure glad you joined us, and I'll see you down the road. Closed caption brought to you by AgriLabs, the perfect pairing of performance and value.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Multimin 90 is an injectable trace mineral product that contains selenium, copper, manganese, and zinc. One injection provides approximately a 60 to 90 day supply for any treated animal. Trace minerals that are ingested by the animal are absorbed relatively inefficiently from the gut. In addition, other elements in the animal's diet, other nutrients, can interfere with trace mineral absorption from the gut. By injecting a supplemental source of trace mineral, we miss those sources of interference. In other words, injectable trace minerals are absorbed with nearly 100% efficiency and used much more efficiently by the animal. The most critical times for trace mineral nutrition in a breeding cow's life are the period immediately preceding calving and the period immediately preceding breeding. We try to treat mature cows, mature breeding cows, about 60 days before each of those critical time period starts. Late gestation and early lactation are going to provide the biggest drain on a cow's body reserves for critical trace minerals. We need to replace those before breeding occurs in order to give that female an optimum chance of conceiving and becoming pregnant for the subsequent production year. Now, in our study at Kansas State University, our cows had access to a cell-fed trace mineral product. Our treated cows were injected at preg check in December, and then again approximately 4 weeks before the breeding season began. The result of our research was a 9% greater AI conception rate and a calving distribution that was shifted forward into the calving season approximately 13%. In other words, we had more calves born earlier in the season than we did in untreated cows.